Very good day to all of you. It is my absolute pleasure and delight and honor to introduce a very well-known academic neurologist, certainly to the World Federation Neurology community. This is Professor John England from New Orleans, and he is very well known to you. He is the editor-in-chief of our own journal that you read and submit your work fondly. John, very good day to you.
And good day to you.
My first question is, tell our viewers about your journey. How did you become who you are today? Start from your high school days and then take us through the journey of you becoming interested in medicine, neurology. You are a world leader in neurophysiology also, above and beyond rest of the other things. So take us through that.
Yes, it's been quite a long but interesting journey. I grew up in a small state in the United States, West Virginia, which is very much a rural state. And I first got interested in medicine by the interaction with my family physician. When I was a child, general doctors pretty much took care of everything. And it was impressive to see someone educated and professional who was smart enough, competent enough to take care of everything. So then I went to medical school, and my desire in the beginning was really to become a family physician or an internist. But I rapidly became very interested in the intricacies of the human nervous system and the brain. And I realized at that point that we can't do anything in life without our brain. Everything we do is dependent upon it. And I thought that that was the most exciting venture to embark upon as a career, because I saw great challenges, but great opportunities for the future of neurological diseases. And then I did medicine residency, followed by a neurology residency, and then a 3-year stint at the University of Pennsylvania in Philadelphia in the United States, where I concentrated on both clinical and research avenues of neuromuscular disease. I subsequently went to the University of Colorado, and then I ended up at the LSU School of Medicine in New Orleans. I have now been the chair of the neurology department for 13 years, and I have commitments to both the Department of Neurology and our Neuroscience Center of Excellence. So I'm very interested in teaching medical students, residents, fellows, young faculty, and helping them develop their own careers now in neurology and research and academics, because as you and I both know, and all of us know, the key to everything is education and research. And I think that over the past few decades, we have seen marvelous advances in neurology and neuroscience. We are now on the forefront of being able to treat many of the diseases which were hitherto designated as untreatable diseases.
I think I agree 100%. The education and research are the two main pillars to add the third pillar, which is why we are here for, to offer world-class service to our patients. I got a question for you, John. Tell us about the Center of Neuroscience Excellence. Let's say that someone from Sub-Saharan Africa or someone from fairly the under-resourced country in Asia, let's say that bright young neurologist who might have completed their PhD in resourceful countries, say USA or UK or Australia, and they have now gone back. If you were to advise them that they want to aspire to build the Center of Neuroscience Excellence in their place, where would they start?
Well, I think they need to start by making sure that they have some training in a world-class facility. And that way they can go back to their home countries, their home cities, their home institutions, and they can start building things. And it's important, I think, to develop not only your research career with mentors who are established in the field, but also to establish contacts in the neuroscience community. And then with hard work and support from local universities, countries, I think that there's great opportunity to do this. And I'll give you an instance. For instance, my good friend and your good friend, Dr. Marco Medina, who is in Tegucigalpa, Honduras, and the representative of Latin America for the World Federation of Neurology, we have developed a collaborative relationship between Honduras, New Orleans, and the LSU School of Medicine, Department of Neurology and Neuroscience to help train outstanding young clinician scientists that will come here and then go back to Tegucigalpa to develop more neuroscience in that country. And so I think that one of the keys is developing collaborative relationships between different institutions, sharing resources, and being able to collaborate and communicate with one another. The field of medicine and the field of science these days is based upon, obviously, knowledge and work, but increasingly collaboration in teams. I don't think that any of us can accomplish anything anymore without developing relationships with one another where we can collaborate in science, on clinical access and care. And I believe that this is one of the focuses of the World Federation of Neurology, and you and I would share that belief. So I think that collaborating, getting well training, and hard work, that's the way you do things.
I think absolutely you hit the nail on the head. Despite we have not seen this happening all over the world, I think when an opportunity arises, like what Mark and you and both departments have been doing, it is very important for all of our viewers to recognize that if you are a super competitor these days, well, your super competition is super collaboration. I would basically replace the word competition with collaboration. I mean, you are a senior editor-in-chief. I am the senior editor-in-chief on one of the online journals, and I have spoken with many other editors. One of the main things that we all look for is how much collaboration is there in these manuscripts, and we wanted to see a lot more names, a lot more connections. We do know that it is very hard for a single brain to deliver things. I think the message that Professor England is giving is that establish connections, establish collaborations, and then the sky is the limit, basically, to build things. I think we have seen, John, with this pandemic, none of us, neither you or me, we didn't think that we would have access to vaccines for COVID-19 by this time of this year, 14 months back. And the power of science and power of collaboration is plainly obvious. I mean, you are now planning to visit Perth in 2024 for the neurophysiology conference, which we are really confident because we would basically vaccinate more than 70% of the world population by that time. So the message, I'm spending some time more here as the way that we can make this exciting field basically delivered to our patients' doorstep is not thinking about what you don't have, but think about what you have. And we have shown that despite we can't travel, I mean, the two of us are in either side of the world, but we are talking about a common, passionate theme today that you would be watching from your own desktop or mobile phone or tablet, wherever you are. It just shows how much the connections that we have at this point of time. So it is very important. Any other final things that you wanted to say on this topic before we move to the other topic, John?
Well, I think that, of course, all of us are having to deal with what happened with the COVID-19 pandemic. And as bad as it was, I think it's reinforced and taught all of us that the world really is very interconnected, that we rely on one another, no matter what country you're in, to survive and to confront diseases, to confront problems. We can't remain isolated as some countries did in the past, because as you could see from COVID, it can spread within days from one continent to another. And I believe that the only way the world is coming to grips with this is by collaborative teams of healthcare professionals, scientists, and and regular people dealing with this. And I think that when I was training, you could actually exist in a small lab and get grants and do pretty good work. But things have become so complicated that even the best world-class scientists can't do it alone now. Things are so complicated that we all have to work together toward common goals.
It was there, John, even before. I remember the way before internet was freely available. The one of the things that I used to do as a young medical student from rural Sri Lanka was reading printed journals that was coming along. So you knew about C. Miller Fisher, you knew about Raymond Adams from those the reading material. I remember reading old material because they explain things much more than what the current reviews said. I remember reading the C. David Marsden's the first description of dystonia. Although you really couldn't put two things together as a sort of first or second year medical student, you could see that here is a clever man describing things. So despite you are in the other side of the world, you still make connections through science. I think now World Federation Neurology has really shined the light globally. I mean, you and me both enjoyed the physical meetings those days when we see different culture, different groups of people, and how much fun we had on top of education with these connections. I think collaboration is the 21st century competition, and there's nothing that you cannot achieve if you put your passion and soul to it. So both of us warmly invite our younger neurologists and neurology trainees to make connections, make collaborations, and dream of building the centers of excellences wherever you are. Despite you may not have anything, they are achievable things that would help you to deliver world-class care to your patients and solve problems. Because when brain health goes off, it doesn't go off as American brain health or Australian brain health or African brain health. It's human brain health. So we are in this together.
And I think one of the things that being a participant in the World Federation of Neurology has taught me and reinforced to me is that all of us are more the same than we are different. And we all have different strengths. If we combine our forces, the sky's the limit. And I think that we're seeing this is happening in science, in neurology, and every other field. So I think what I would encourage young people to do is get involved and get involved early in helping solve some of these problems.
Absolutely. John, my next question is, you are well aware that the World Federation Neurology introduced this World Brain Day concept in 2014, and it has really taken a huge momentum now. I'm reasonably confident this year we would surpass 100 million mark easily, despite the lockdowns as people achieve things virtually. To the extent I released a short video a few days back asking people to post on Brain Health World Brain Day because I wanted to see 1 million posts. But last night I changed it to 2.8 million. I thought that, well, I could raise the bar given that there are 2.8 million patients, the people with multiple sclerosis. Perhaps we could raise the bar further. And then we joined this year with another powerful advocacy organization, Multiple Sclerosis International Foundation, who has a lot of connections, well over 110 countries worldwide. And both these organizations, under the patronage of World Federation Neurology, this year is tackling multiple sclerosis. We want to have this ambitious campaign, Stop Multiple Sclerosis. How excited are you as a world leader in clinician neuroscience to see two massive global organizations with links all over the world trying to take multiple sclerosis head on as sort of the year-long World Brain Day campaign this year?
I think this is very exciting, and it reinforces just the thing you and I were talking about, is collaborating, working in teams to solve problems. Both the World Federation of Neurology, which of course is allied with the World Health Organization also, and the Multiple Sclerosis International Federation, by combining forces, I think that we can help educate, people around the world, because as you know, multiple sclerosis is an incredibly important disease. It's the most common immune-mediated inflammatory demyelinating disease of the central nervous system. It is one of the leading causes of chronic disability in young adults. The mean age of diagnosis for young adults is like 32 years of age. And this hits people in the beginning and prime of their life. So it has such important problems, not only for brain health, which affects everything that a person does, their ability to function, their ability to interact with social groups, their families, their occupation. And I think that the more awareness that we have about multiple sclerosis and the ways that we can increase access around the world to not only early diagnosis, but early treatment are most important. We now have, I believe, more than 20 disease-modifying therapies for multiple sclerosis. When I was a resident, we had really two things, steroids and ACTH. Now we have all of these biological agents, oral agents, the original platform agents, which with early treatment can not only decrease the disability, but in some cases stop it. So this is exciting. The problem is, even in developed high-income countries, but more so in low-income countries, there is an incredible problem of access to expertise with multiple sclerosis, not only for the diagnosis, but especially for the treatment. And this is a multifactorial problem, which not only is just access to experts, but the ability to pay for the health care of these disabled patients and to pay for their therapies. So anything that we can do together to increase access and to help patients with this disease get better is a really big step forward.
Absolutely. And the reason that we are advocating for 2.8 million posts, because we both know the power of social media, given that we have 2.8 million people of the very prime of their age that you very correctly pointed out, all over the world, irrespective of their color, ethnicity, background. Another sad story is that despite this, almost 2/3 of these patients can't access early diagnosis or treatment. We both know as practicing clinicians that with powerful therapeutic armamentarium that we have now, you could almost stop this disease. And that actually led to a new term called NEDA, no evidence of disease activity, which you and me both didn't hear during our residency status, as it was not available at that time. So by raising awareness and making people aware, it is easier for different countries to talk to their policymakers and funders to get this treatment access and early diagnosis. Therefore, this synergy, this collaboration, and this massive global advocacy campaign is basically very much the need of the hour. And the other thing is, John, as you very correctly pointed out, we learn whole heaps out of COVID-19 at a personal level, as you know, because you published some of our work. We realize the critical role of neuroinflammation in almost any neurological disorders. I personally saw direct similarity between COVID-19 affected brain and stroke patient that I see. I went ahead and did a very simple calculation by looking at neutrophil count, platelet count, and lymphocyte count, and then we define a new term called serial systemic, the immune inflammatory index. To my surprise, you're going to see the manuscript soon as a sort of short communication letter. The 10 patients that we saw as post-stroke neurological complications 4 years down the track, and 10 patients that we manage as post-COVID-19 neurological syndrome, it really threw me out of my chair. The very simple marker, the behavior was exactly the same. So it just tells us that how immune system is basically deciding what is going to happen to us when our brains get sick, whether it is stroke or multiple sclerosis or COVID-19, for that matter, indeed, I am eternally optimistic as science and neurology is in this together. We don't have any politics when it comes to collaborations, and we both know that collaboration is the 21st century competition. I think when we come out of the other end from this pandemic, we would see a much better world. My next question is, John, I know that you are a very busy person. You have so many hats, and the editing a key journal for the most largest neurology academic community is not an easy task. And being a chair of the department, being one of them myself, I know is not a hard task also. But you also have the pretty decent human life. So tell us, outside medicine, how do you spend time, and what is your message to work-life balance and preventing burnout and those sort of things, which are also appearing in these days, which are probably even more important in sort of this sort of crisis?
Well, you raise a very important point here. I have found that the key to being happy is to have a balanced life. So medicine and neurology have been my passion since I was a student. But I think what I would advise all physicians, and especially young physicians, to do is to have other interests. I think that if you spend all of your time just working, you're not only going to be boring, you're going to burn out, you're going to have mental health and physical problems. And so I have several things I like to do. I exercise almost every day. I run, I cycle, I go to the gym. I snow ski as much as possible because I love skiing. And I love reading and learning about things other than neurology. When I was in college, I had a very liberal education. So I love reading about things that aren't really related to neurology per se, although everything in life is related to the brain to some extent, but philosophy, psychology, history, all of these things are fascinating topics. And I think that to be well-rounded, you have to engage yourself in activities that make you well-rounded. And I think it will balance your life more. But it's important to find some way to relieve stress. We all have stress, and during last year, most of us had a lot more stress than usual. And unless you have other ways of coping with that, with doing other things and spending time with your family, your profession will suffer, and you will suffer personally in the end. So that's my advice. Try to lead a more balanced life.
I think that is a very good advice. I think those things that you mention also bring the dimension of humanity to our life. I remember during my medical school days, our medical school, although it was in sort of not in a sort of main city of Sri Lanka, it had 8 faculties. I spent a lot of time every now and then in Department of Philosophy. I remember attending to some discourses that were done in English that would fine-tune my English skills. At the same time, the spiritual side also. So they were basically take various religious teachings, and all the senior professors would analyze. This is what they meant at that time, and this is how we could incorporate this to our day-to-day human life. And the other thing, reading things outside neurology, that basically bring basic human emotions such as love, compassion, kindness, those things to our life. So they're excellent advice that you gave our audience, that reading things outside neurology, and even watching movies when if you get an opportunity. And so there are some great products out there, some in English and some with English subtitles. There's enough wealth of information that folks have generated for years that are at our doorstep, especially with Kindle and other things. It's so easy for us to get them.
So there are so many interesting things in this world. In fact, many days I wish I had more hours to spend more time learning other things, because there's so many great things. And if you look back, what I encourage people to do is read important things, read important works. It's not only helpful from a balance standpoint, but what I have found editing journals is that many people, even those who grow up speaking English as their native language, haven't really learned to write very well, and they haven't learned to think very well. And I think if you read classic works and you read great authors who have a worldview that you don't have, you read great writing, you'll learn how to write better.
And the other thing is, John, the artists, they see things very differently to others. It's almost like they got a sort of third or fourth eye. I remember reading some of the Sri Lankan literature or Russian literature. The way that they portray things is unbelievable. And in fact, every country own rich the literature traditions, and we are fortunate that they are most being converted to, or the translated to English these days. And I think they are very useful for you to become a well-rounded person, as you very correctly pointed out. Then you can still work hard, and chances of you seeing burnout is significantly less. Among all the things that you mentioned, I do most of them, except probably going to the gym, as we had too many lockdowns during last month. I run or walk in the interim. I like animals and outside as much as possible. I got 2 little dogs, and I enjoy them thoroughly. And every opportunity that I get, I go and watch birds, because sort of describing them and analyzing them, almost like describing a particular movement disorder. I remember looking at a particular Australian bird called Gouldian finch. They have different color head shapes, but genotypically they are the same. When I teach residents, I tell them, I put a photo and then I tell them that just like you describe different colors of this beautiful bird, the progressive supranuclear palsy, multiple system atrophy, the Parkinson's disease, it has sort of same sort of a principle, how you differentiate one from the other, although it's far from the real complexity. John?
No, I think you're quite right. I think that we have to get out in the natural world and appreciate the world. With all of its problems, the world is still a wonderful place, and we can learn very much if you just get outside and get into nature.
It absolutely saved my life, which I would be happy to share here with you. I remember, I think as a second year medical student, I became very sick. I was doing an assignment as we had a summer break, and I got appendicitis and I was operated. But I told the doctors who were looking after me, as my parents were far away and friends were far away, not to tell anybody. So I was in hospital for about 6 days or 7 days. But I didn't realize that I became pathologically depressed when I came home, which I didn't know, obviously. And then I was now depressed, and I was wanting to take my life away. And then as I was plotting how I do that, as I was sort of recovering in my rural home, it was in the top of a mountain. I was lying under a tree where sort of it almost looked like sky and earth meeting with each others, with nice clouds and a lot of green trees. While I had sort of handwritten note and how I end my life and this and that, suddenly a part of my brain started to tell me that, look, Tissa, look at all these beautiful trees. Look at all those beautiful birds who are coming and going. Look, some of the old trees which are dead. Look, some of the young tree branches which has fallen off. Look that the natural things, they don't decide when to go. The nature decide when to go. They don't do this purposely. So that part then got activated, and then those suicidal thoughts and really depressive thoughts started to go off. Later on, when I realized more science and theories behind depression, I realized that it was the part of the brain that I have been training since childhood unknowingly, appreciating nature probably saved my life, because I was not going to talk to any counselor from that rural place at that time. I was almost at the verge of leaving this place rather than staying. I think I was like 18 or 19 years of age at that time. Thank God that I stayed around, and I'm still the running all these things. So it's a great thing to fall in love with nature.
Well, gee, I'm certainly glad that it worked out for you. That must have been a very trying time. And I believe that we have to keep mindful of the fact that our patients have all of these problems magnified. You know, when I'm making rounds with the residents, sometimes it's very late in the day or early in the morning. If I hear them grumbling, I say, well, just think, at least you're not the one here in the bed. You don't have this horrible disease that we're talking about sometimes. And even though multiple sclerosis is not always a horrible disease, I think it's important to understand that these patients have a lot of other problems that we sometimes forget about or we don't address. They have cognitive problems, fatigue, depression, pain, trouble walking, sexual dysfunction, lots of things that we need to take care of as physicians and to ask them about, because sometimes they won't tell you about these things, but they can be some of the more disabling problems of this disease, as well as other neurological diseases. And many of these other things can be treated, or they can be helped.
Oh, totally. I think we both know the importance of patient-centered approach, and it's a skill that we both probably continue to try and learn after each patient. I always tell my residents also that it's a learning process, and being a patient is probably one of the hardest experiences of any human beings, and it's much easier to be in the giving end rather than in the receiving end.
Absolutely. And we have to understand that these diseases like multiple sclerosis affect not only the individual affected, but their family, their friends, their social contacts, their occupation. So we need to keep a humanistic eye on how we're treating patients and treat the whole patient, not just start giving them a particular drug for the disease. We need to actually look, examine, and help the quality of life measures that some of these patients have trouble with.
John, it had been the wonderful experience to chat to you today. I think I still need to let you talk about our journal also. Anything that you wanted to tell our viewers, given that we are now running a big global advocacy campaign, do you think that there will be one day that we could even think about you are launching this tropical neurology special edition, that we could perhaps concentrate supporting global advocacy campaigns and plan a dedicated advocacy issue or sort of dedicated pages into the future? So I basically ask two questions. One is the synthesized summary appealing to global neurologists to produce good, high quality work. And the second thing is potential for creating some space for advocacy work in time to come.
No, I think that's a very good idea, and we'd be happy to do that. That's one of the most important missions of the World Federation of Neurology. And since the Journal of the Neurological Sciences is the official journal, we would be happy to have a special session on that. And in fact, our past president, Rod Shakir, our current president, Bill Carroll, and the Secretary General, Wolfgang Griswold, are very, very interested in advocacy and those issues. And we've talked about that many times. So I think that we should move forward. The journal is a general neurology journal, and we obviously like great scientific papers, but we have a mission to serve the focus of the World Federation of Neurology, and part of that is advocacy of patients, neurologists, and increasing access and care for patients with neurological diseases.
Excellent. So there's, as the viewers can see, the Professor England is very supportive to see your work. So make sure that you seriously consider submitting your high quality work in science, clinical practice in neurology, and in particular advocacy. Also, hopefully we would have some special sections coming up into the future, and make sure that you think of our own journal as the first destination before you think elsewhere. Any final thoughts for the medical students, young trainees, and neurologists in any stage of their career globally, John, although we did talk about few things in the past?
I think in medicine, like in life, you have to follow your passion, and you have to decide what it is you really, really like to do. And when you find that, work hard, but also take time to play hard, have a balanced life. But there's nothing that's been more rewarding for me than a career in medicine, especially neurology. We have a special status in society, but also a very special obligation. And I think that the only way that we all do this is by working hard and working together. And with that, many things can be achieved. As we've just seen with the COVID pandemic, working together, we now have all these vaccines that, as they are being launched, are making a big difference in this pandemic.
You are absolutely right. I can't imagine why people would choose anything else other than brain science, because it is all about us. It just explains how we think. It just explains how we feel. It just feel how we become sick. It just feel how we respond to a particular sickness. Although all these things have subtle differences with your cultural background and your belief system and how you grew up, the basic problems that we all deal with are universal. When we feel sadness, there's no sort of a difference between New Orleans sadness or Sri Lankan sadness or Australian sadness. It's just human sadness. Same with when we feel jealous or angry or happy. So if the problems are universal, solutions are largely universal also. I think the science and neurology has beautifully recognized that. So the summary that the John is giving us is that follow your passion, work hard, play hard, have a balanced life, be kind to each other, I would add, and then be compassionate to each others. And we are in this together. Collaboration is the key. John, thank you so much for giving us time despite your very busy schedule. I know that you stayed over to support me with this interview, and we greatly appreciate your hard work in communication by being the editor-in-chief, and you have served or continue to serve in multiple committees in World Federation Neurology. We truly appreciate that, and we wish you very well. Stay safe and stay healthy. We want your service more to establish these collaborations globally. Thank you so much once again.
Oh, Tissa, thank you very much. It's been my pleasure and honor.
Thank you. Take care and stay safe and well.